This episode's discussion surrounds how hospitals and health systems can use smart technology for actionable intelligence, making their hospitals smarter and safer.
So today, hospitals have building automation systems, which capture things like temperature and humidity control, and they've actually been around for decades. The problem is that they're often hardwired. They're designed to operate as an independent system, and the transparency of the data is often suspect. So as a result, these systems are somewhat antiquated, and they're not giving owners really the information they need to make smart decisions.
So today in our facilities, we have multiple different sensors that are tied into multiple different systems. Those sensors are as simple as a thermostat in an exam room or an occupancy sensor connected to a light in an office. Those sensors are gathering data all the time, but that data only goes back to their respective systems. And it's not currently rolled into a larger framework where we can aggregate the data and use it to make better decisions. Fortunately, we're at an exciting time with advances in edge computing and cloud computing and post-processing machine learning intelligence that allows us to aggregate that data on site from multiple systems, deliver it off-site to a warehousing and cloud storage, and then apply post-processing and analytics to the information to help us make better decisions about how we operate our facilities. So a great example is our lighting occupancy sensors. Lighting occupancy sensors are outfitted in nearly every office. They're constantly gathering data about the occupancy of the space, and when they receive that data, they provide an actionable output, turning a light on, turning a light off. That data is very rarely stored or trended. If we're able to aggregate that data and trend it, we can go back and look at the usage patterns of those spaces and use it to make better decisions about the operational efficiency of the space.
One of the other benefits of collecting all this data and analyzing it is that we can use it to make decisions about future expansions to the hospital, as well as current situations within the hospital on how we improve something like energy efficiency. Look at the ventilation that's being provided to different spaces and what the patient satisfaction is. We can hone in on what is the right level of ventilation to provide to that space. We can literally track patient satisfaction over time in different areas of the hospital and tie that to all these different systems and see what the effect of adjusting those systems could actually have on patient impact.
This technology allows migration to a demand-driven service model, where you're providing services based on need rather than some predetermined schedule. One of the ways that I kind of explain a demand-driven service model is if you think about, the house where you live, you may have a guest bedroom. You don't clean that guest bedroom every day because you know it hasn't been used, right? If you had that same kind of insight into your other spaces, you would know what space needs to be cleaned and when. If it's occupied or not occupied, that would influence the type of conditioning you provide, which also has a benefit on energy management. So a demand-driven cleaning model really allows you to provide a greater efficiency in your space and really capitalize on the value of your physical assets.
I would say that those systems that are there they're not improperly specified or doing the wrong thing. They're doing what they're designed to do. What we have now is an opportunity to use them to do more, to use their infrastructure by applying an infrastructure on top of it that aggregates the data that they're already collecting. And not only aggregates it from one system, aggregates it from multiple systems. So we can have a warehouse of metadata that we can use to understand the facility and improve operational efficiency.
As a healthcare leader, you may not realize how your systems are engineered in your hospital. And you're probably providing a lot of heating and cooling simultaneously. And that's wasting a lot of energy. And you can recover a lot of that resource by analyzing this data and perhaps adjusting that so you're providing the right amount of cooling in the right spaces and the right amount of heating in the right spaces. This could overall, reduce some of your costs, and 2% of your operating margin is probably on energy. And while it's not a big number in the scheme of things, anywhere we can find some savings in healthcare is definitely worth exploring.
To better deliver services to patients because you're providing, they're wired and they're monitored and you can see how they are performing. That same thought process can be applied to your physical space, and you can see when space needs to be serviced, when equipment is nearing failure, and you can prevent that failure before it occurs in a critical environment, such as in an operating room during a surgery. So this digital transformation of space allows building owners to get greater value out of their physical assets.
As a hospital leader, it's very easy to think that the patient satisfaction scores, with the way they're reported, that only one of those areas has anything to do with the actual physical environment. Typically, the ventilation, the heating and temperature section. But the reality is that the physical environment can play a major role in all 8 of the areas that are actually asked about patient satisfaction. One example is how communication between the patient and clinical staff occurs. If the physical environment isn't set up right, if there's excessive noise, if there's a design layout that requires the doctor or nurse to have their back to the patient more than being able to face the patient in order to do charting or washing their hands, for example, that can lead to a perception that the communication is poor and reflect on the surveys. By taking a look at all this data together and looking at the design and the physical controls that have been provided, you can actually start making decisions about how to improve your environment to provide better patient satisfaction.
Chief administrators, hospital administrators need to understand is that the cost of this technology has been dropping precipitously. And that's why I said it's disruptively inexpensive. The installation is very simple. It's not hardwired. It doesn't involve the hospital's existing IT system. And you can censor as much or as little as you want. And sensors are very inexpensive. So this is not something that's going to break the budget. But the value you get in the data, the quality you get in the data, the insights that come out of that data will allow you to be more competitive.
In a situation like the pandemic, to be able to analyze all this data on the fly can give you a real insight to what needs to be changed to address something like patient surge. You typically design systems for one patient in the area. What happens when you add 2, 3, maybe 4 patients in that area? How does the system need to respond to ensure that you're providing not only patient comfort, but also the highest level of safety?
During that time, the decisions were made moment by moment, right? Some are right, some are wrong. But to be able to collect actionable data on that whole event and then go back and look at the decision points and look what the results of those decision points were can help us so that the next time we have a traumatic event or a similar traumatic event, we can make sure we have protocols in place that drive us to the right decisions.